Hi, this is the case study presentation for week 10, and the three differential diagnoses are small cell carcinoma, weakness, and pneumonia. Next slide. This patient presented to the emergency department from a long-term facility. He's lived there the past year. He used to live with his son and his family until recently. He lost his spouse 3 years ago, has lost 20 pounds the past 6 months without trying or for no reason at all. He does appear lonely and sad. He presented his presenting medical history includes a 30-year history of smoking, although he has been trying to stop. He did have diminished lung sounds. As mentioned, the weight loss. He mentions he has had no appetite, has a history of hypertension. He's from a long-term facility, a fever of 100.9, and history of a fever for the past 3 days. His past medical history includes history of congestive heart failure, although managed very well. History of hypertension, on which he's taking lisinopril for. He did have some reoccurring pneumonias in the past, although not recently. He's had no surgeries or no allergies at all that he knows of. Medications he's currently taking is lisinopril. He does take a daily aspirin and Tylenol PRN for pain or for the fever that he has had. The lab values that have been drawn or we're currently working on in the emergency department include the initial workup, which revealed pantocytopenia with a platelet count of 84,000. He had a white blood count of 19,000. A urine culture was done and, of course, sent. His hemoglobin was 8.3. Neutrophil count increased. The blood cultures were drawn, and a CRP is waiting evaluation for any infection. The three differential diagnoses that we're going to be talking about are pneumonia, small cell carcinoma, and weakness. And I picked those three because I feel like the patient could be presenting with all three diagnoses. The radiology tests that were done in the emergency department was a chest x-ray onto a chest CT with contrast, and in the end a needle biopsy was performed as well. Now on to pathophysiology of the squamous cell carcinoma. Squamous cell carcinoma is a growth of epithelial cells, and in this case this patient had a grade 3 squamous cell carcinoma revealed by the biopsy. It was in his left lung mass. It appeared to be a painless tumor. It could have been a nodule as well. We're waiting on pathology to come back. In this case, lung cancer is one of the most common malignant tumor worldwide with the highest morbidity and mortality. This was my reference for the pathophysiology of squamous cell. Squamous cell carcinoma can also appear as lesions and different nodules. I posted my reference for that reason as well. The pathophysiology of weakness is, I built this into this diagnosis because patient did appear weak. He had limitations and restrictions. He's probably been in bed at the long-term facility because he hasn't been feeling good. He was very fatigued. He needed assistance to walk. It could be contributing from his low hemoglobin of 8.3 and also his overall weight loss that he really has had the past 6 months. Now, the pathophysiology of pneumonia present with this patient, since he presented with some of the same symptoms that could be both weakness and small cell carcinoma. He did have a fever. He appeared congested. He did have signs of inflammation. He had the increased neutrophil count. And he's been in a long-term facility, so it could be in a community-acquired pneumonia. And community-acquired pneumonia are also one of the most common problems in the U.S. worldwide. And I posted my reference to the pathophysiology of pneumonia there as well as at the end. My references are at the end of the case study, and my thoughts on why I picked these three differentials was this patient came to the emergency room. He had different signs and symptoms of different illnesses. In this case, he could have the pneumonia, which it could have been an acquired type of pneumonia that he's had. He probably has had the lung cell carcinoma for a little while. It just suddenly was probably brought on by the pneumonia cause or the other illness of the weakness. So patient really could have all three of these diagnoses all at once. The small cell carcinoma could just have been found later in a stage because he did have the stage 3 diagnosis as well. So he could have had it for a little while, which could be contributing to his weight loss that he recently has had. This concludes the case study and any pathophysiology and thoughts that I found through my research. Thank you for your time.